Hello, welcome to this presentation on the Royal Perth Bentley Group Graduate Transition Program. The program is commencing in February 2023. My name is Marie Yearwood and I'm one of the nurse educators who assists in coordinating the Graduate Transition Program. I would like to start with an acknowledgement of country. I acknowledge that this land that I live and work on is Whadjuk country, and that the Whadjuk Noongar people of Perth are the traditional owners and custodians who have a rich social, spiritual and historical connection to this country, which is as strong today as it was in the past. Royal Perth Bentley Group is part of the East Metropolitan Health Service and comprises two hospitals. The first is Royal Perth Hospital, which is a tertiary adult healthcare service. The hospital is home to the State Major Trauma Unit, which is a dedicated area that facilitates improved coordination and management of patients who require multiple specialties following their trauma incident. It's also home to the Health in a Virtual Environment service. This is an artificial intelligence service that also uses clinical staff to provide remote monitoring of patients who may require specialist care. At Bentley Health Service, they have services in rehabilitation, medical, surgical, and also specialist mental health services that cover youth, adult and geriatrics. Royal Perth Graduate Transition Program will provide you with the best start to your nursing career. We are a flexible, supportive employer. We will provide you with a range of experiences and many opportunities for learning. At Royal Perth and at Bentley, we employ both registered nurses and enrolled nurses. So a little information about the RPBG graduate programs. Our programs are evidence-based. This means that research on graduate programs is reviewed regularly and changes have been implemented in 2014 and 2020. We value the contribution of our graduates and we actively seek graduate feedback. For example, we have graduate representatives as part of the Graduate Nurse Working Party. The programs use formal evaluation tools and the results of the evaluations are incorporated into the GBP. For example, one tool we use is an internationally validated research tool to look at the measurement of nurse competency. So the key features of the Royal Perth Bentley Group GTP. Support. This acts to help graduates feel welcomed, valued, and to develop a sense of belonging to the organisation. We achieve this through a graduate-specific 4-day induction program, as well as supernumerary time in the clinical areas. When graduates start in the new area, we have what we call an intense support period with additional clinical support to help you settle and achieve your basic competencies for the area. Socialisation. This is a process by which graduates acquire knowledge, skills and an occupational identity. And we achieve this by keeping graduates in specific groups so you meet with the same graduates every week or every fortnight for your education. You also will have socialisation within your specific clinical areas. Facilitated learning. Through graduate induction, plus ongoing education and development, with regular graduate education sessions and a graduate-specific study day. Because we know your learning doesn't stop when you finish your nursing education. So, some more information about the program commencing in February 2023. First of all, we'll look at the Royal Perth programs. Royal Perth is offering both 6-month and 12-month programs for registered nurses. For RNs, placements can be 6 months, which is a single rotation and a contract of 64 hours, which is 4 days each week. Or 12 months, which is 2 times 6-month rotations, and the contract is a 72 hours, so 9 days per fortnight. We have a very small number of 12-month placements in a single area, and that is to the operating theatre. Clinical areas that registered nurses can access as part of the GDP include medical, surgical, and specialty areas. Specialty areas include the intensive care unit, the emergency department, the coronary care unit, cardiology area, the imaging department, the recovery unit, the endoscopy suite, medical day unit, and mental health areas. For our enrolled nurses, we are also offering 6-month and 12-month programs. For ENs, 6-month, single rotation, 64-hour contract, so 8 shifts a fortnight, 4 days a week. Or 12 months, 1 rotation, and a contract of 72 hours or 9 shifts a fortnight. We support that our enrolled nurses, because of their shorter training time, need more support in the clinical area, and for that reason, we offer 12 months in 1 clinical area. Clinical areas available for our enrolled nurses are medical, surgical, and mental health. Bentley Health Service offers a number of different graduate programs. They have a 6-month mental health program for RNs and ENs, so that's 1 6-month mental health placement. They have a 12-month mental health placement program for registered nurses. And this is a mental health specific program designed for registered nurses who are interested in a career in mental health. And that program is undertaken in partnership with Notre Dame University. So graduate nurses will be required to undertake 2 fully funded units of study which form part of the Graduate Certificate in Mental Health Nursing. Graduates in this program will complete 2 6-month mental health placements. There's a 12-month program, mental health program, for enrolled nurses. And this will allow enrolled nurses to complete 2 6-month mental health placements. There are 6-month general health programs for RNs and ENs. These programs provide 1 6-month general health placement. A 12-month comprehensive program for RNs. So this offers 2 6-month rotations, 1 in mental health and 1 in general nursing specialty. And that form of program is really ideal for those nurses who are interested in maintaining some mental health skills but also want to develop some general nursing skills. The last 2 at Bentley, a 12-month general health program for enrolled nurses. This is a comprehensive program that offers 12-month general nursing specialty. And lastly, a 12-month perioperative program for RNs. This is a theatre-specific program designed for registered nurses who are interested in a career in perioperative nursing. So I'd like to share with you some common questions we get asked about the Royal Perth Bentley Group GTP. Firstly, if I want a graduate program at RPH or Bentley Health Service, do I have to place RPBG number 1 in Grad Connect? The answer, yes, you do. RPBG fills its places in its graduate transition program after the first round. What happens after my application goes into Grad Connect? We appreciate the effort that you have all put into putting your applications together and writing your selection criteria. We send all applicants an email acknowledging their application, so you know it's been received by us. Once applicants are shortlisted for interview, an email invitation is sent. If you are not shortlisted or you are not successful to the GTP, then we would absolutely encourage you to seek feedback from the GTP coordinators once the recruitment process has ended. And we're very happy to provide feedback on applications. Other common questions. How many graduate nurses does RPH and Bentley Health Service take? We do not declare how many graduates RPBG takes. All we can say to you is if you want a GTP at Royal Perth Bentley Group, then you need to place Royal Perth Bentley Group number 1 on Grad Connect. Can I request which clinical areas I am placed in? If your application is shortlisted for interview, then we will send you a survey through SurveyMonkey asking you to select your clinical areas of interest, and we ask you to rank them in order of which ones you want most. This is a common question that we get. How do I get a graduate placement in Royal Perth Hospital's intensive care unit or emergency department? We know those are popular areas, and a lot of graduates see that those are areas that they would like the opportunity to work in. Allocation to a specialty area is based on an individual graduate's clinical area of interest, the graduate's written application, and the graduate's performance in interview. So all those things will be taken into account before we make a decision about placements. What happens at the end of the 6 months or 12-month program at GTP? There will be a process for allocating graduates to clinical areas following completion of their program. And you don't have to stay in the area that you've completed your program. It really depends on what areas are available at the time that you finish. But quite a large percentage of graduates change to a different clinical area from where they completed one or both of their rotations. Can I work part-time? Yes, there is an option to reduce your work hours. There are minimum hours stipulated, which you need to be aware of. We ideally want you to work at your contracted hours in the initial weeks so that you can consolidate your clinical skills and your time management. And we also want to be there to support you to make sure you get the best start in your nursing career. So, in summary, Royal Perth Hospital and Bentley Health Service graduate transition programs are a 6-month or a 12-month program, and these are for programs commencing in February 2023. The key components of the GTP are support through induction, through the intensive support period, and then ongoing support with the staff development nurses in the clinical areas. Socialisation in clinical areas and with other graduates, and ongoing learning through study days and our regular education sessions, which is specific for graduate nurses. So, in conclusion, we look forward to welcoming you to the Royal Perth Bentley Group. Thank you.